It's hard to tell how much healthcare actually costs, but our next guest is trying to shine light on healthcare costs. It's an important task for State Treasurer Dale Folwell. That's because he oversees the state health plan for government workers and retirees. Welcome back to the program.
Well, thank you for having me so we can talk about more transparency and lower cost.
You are tackling this issue through the state health plan through something that's called the Clear Pricing Project. Before we get into the details of that, tell us why this is something that is important to anyone who's connected with the health plan.
Well, whether you're on the health plan or not, you're either on the plan or you're being asked to pay for the plan, because this affects all citizens of North Carolina that pay taxes in any way, shape, or form. The why is simply this. The state health plan, which is the largest purchaser of health care in North Carolina, has not been taking advantage of its buying power. The reason that is that the state health plan for years and decades have been in deals that, for lack of a better word, are secret contracts where no one knows the price and the value of what they're getting. And so what the Clear Pricing Project does is it brings transparency to health care. It pushes the control out to the consumer. And we are very confident that's going to allow us to lower costs for state employees and taxpayers like them who fund the plan.
Now, we're not going to get too far into the weeds, but one of the keys to this is basically you set reimbursement rates and say that this is what we're going to pay. It's not going to be something that will vary from place to place or time to time.
Sure.
This is going to be what we're going to pay.
It's called reference-based pricing. And the reason we went to reference-based pricing is we sent a records request to one of the largest hospitals in North Carolina, and this is what they returned to us as the master charge list or the price list for health care at that facility. For your listeners and viewers, I'm thumbing through a 140-page document where every single part of the document is blacked out. And the fact is that as the state treasurer, we're spending over $3 billion a year of taxpayer and member money on something we don't know the price and the value of. So to get into the weeds, reference-based pricing is basically based on Medicare reimbursement rates, not Medicaid. And then we just announced 2 days ago that we're going on average almost 100% over that. So almost double the Medicare reimbursement rates. To put that in context for your listeners, Mitch, prisoners, if they need medical attention in North Carolina, get services at 40% over Medicare. People, unfortunately, who are injured in workers' comp claims, the providers get reimbursed at 40% over Medicare. We're offering 100% over Medicare for the people who teach our kids, protect us from criminals, and pave our roads. We think it's very reasonable, and that's all we're doing with the Clear Pricing Project.
We are speaking with State Treasurer Dale Folwell about the Clear Pricing Project. Despite what sounds from what you were just saying like, hey, good deal, there's been a lot of pushback. This has been a major political issue. Tell us about what you've been trying to do to overcome opposition to this.
Well, the first thing that we know that can help us overcome this is that every one of your listeners has their own story about healthcare cost. Surprise billing, out-of-network billing, people being sent to collections for healthcare costs. So everybody in North Carolina knows there's a problem with healthcare. And the big problem, to kind of sum it up, is that they don't consume healthcare in this state. It actually consumes them. In order to consume something, you have to know the value and the price of what you're getting. In healthcare, it's like going to a grocery store where there not being any prices on any of the products. They take a payment from you at the checkout, and then 4 months later you get this bill in the mail that you don't understand. So the Clear Pricing Project, we're very honored that since we've launched this, we've had 27,000 providers of healthcare who have signed on the Clear Pricing Project across North Carolina. These are providers of healthcare. They want to be a part of open contracts, giving the control to the consumer and lowering cost. For this, you mentioned the word political. This is not political or mathematical or emotional for us. This is mathematical. The fact is that our healthcare and pharmaceutical costs are going up at a much faster rate than the appropriation coming in from the General Assembly. On top of that, which is North Carolina's insolvency of its state health plan is right behind the state of Illinois. Same Illinois that your listeners have become familiar with as a state that's not in good shape. They should be asking themselves right now, how is it possible that our insolvency is right behind Illinois? And the fact is that we've been making promises for lifetime health, to be eligible for lifetime health care in many instances after 5 years and 1 day of service, and no money has ever been put aside for that. That's why we are spending all of our attention attacking this problem of runaway health care cost and secret contracts, and the people that are opposed to us are just attacking us.
You mentioned the 27,000 providers. There's still some key providers that have been holding out, fighting this. What efforts are underway now to try to get all the other important players on board?
Everything it takes and then some. You know, for a year, we've answered every phone call, every email. We've attended every meeting by any of these major providers. And basically, at the end of the day, they try to steer us into something else. You know, we're interested after we figure out what we're supposed to pay. And I say that sort of sarcastically. You can't cut the cost of anything unless you know what it costs. And you can't value anything, whether it's the car you're driving today or the suit you're wearing. You can't value anything unless you know what it costs. So our strategy is this, reference-based pricing, so that we can figure out what we're supposed to pay. Secondly, we're going to bundling. Bundling is most associated right now with carpentry, which is knees, hips, and rotator cuffs. Bundling is where you go and you pay one price. It's for the titanium screws, the Band-Aids, the anesthesia, the physical therapy. People know exactly what they're getting when they go in and get their knee replacement. They know exactly what the total cost is going to be. The third factor is alternative payment arrangements, and then we'll see where we go from there. But the fact is the state, as keeper of the public purse, we're spending almost over $3 billion of taxpayer money, and we don't know what we're getting for it.
Is it fair to say that one of the reasons we're in the state that we're in right now is that the state health plan has basically been seen as somewhat of a cash cow by healthcare providers, that they might have to they might have to pay attention to what they're charging to other folks, but they've looked at the state health plan as a way to just make easy money?
We haven't been able to prove that, but sort of to your point, every string that we've pulled on over the last year regarding clear pricing, we've never gotten to the end of any of it. Because every time we think we're at the end of a string that we're pulling on, we find something else that we didn't know about it. If you take their words of the leaders of the hospital association who are fighting us about on clear pricing, if you take them at their word, one particular major medical center says that, and I hope this comes across on the radio, that we make up 4% of their business, and by cutting costs 10%, we're going to wipe out 40% of their profit. What other mathematical explanation is there to your question than when you only make up 4% of somebody's business, and by cutting expenses, you're going to wipe out 40% of their profit, other than the fact the state health plan has been looked upon as a cash cow. And these billions and billions and billions of dollars worth of reserves that are sitting in these nonprofits, which is kind of I think a kind of awkward term. These people are for-profit, no matter what they call themselves. These billions of dollars of reserves that are sitting in these nonprofit bank accounts across the hospitals across North Carolina, not all of them, but many of them, one has $5 billion in the bank. If you look at the fact that we're the largest customer, most of those reserves have been built on the profit of people who teach, people who protect, and people who serve us in state government.
Last item for you. If we don't address this, if the clear pricing project were not to go forward, or not to go forward with all the providers who should be on there, what negative impact will we see for the health plan? Well,
we have an obligation to provide accessible, affordable health care, and that's as a fiduciary, we have loyalty and duty of care to that. If what will happen in the health care, the state health plan, is that we'll run out of money within the next 3 years. And that's obviously a dire situation. So what we're trying to do is we're trying to take advantage of our largeness. But for us not to be successful in clear pricing means more secret contracts and higher cost.